Cardiovascular disease is an umbrella term for a class of diseases that affect the heart or blood vessels, and it's estimated that they're the cause of 17.3 million deaths in the Western world. Some examples include coronary artery disease, which are things like angina or myocardial infarction. There's strokes, there's hypertension, there's venous thrombi, and there's aneurysms. And the underlying mechanisms that cause these diseases varies between which ones that they are. But some include things like atherosclerosis, embolisms, and infarction. And thinking about cardiovascular diseases, there are quite a few risk factors that you have to take into account for people who are obviously at a higher risk of developing different types of cardiovascular diseases. So, people with these following symptoms are more likely to develop cardiovascular diseases. So, a higher blood pressure if they're smokers, excessive alcohol consumption if they're diabetic, if they do reduced physical activity, so they have a lack of exercise, if they're obese, if they have high blood cholesterol, which sort of goes hand in hand, and if they have a poor diet. A huge risk factor for cardiovascular diseases is hyperlipidemia. So this is an increase in sort of cholesterol. Cholesterol is good and it's important for things like cell membranes, steroid-based sex hormones, vitamin D, fluid that coats the lungs to reduce friction, and the myelin sheath around axons. They're also circulated in the body fluids as lipoprotein particles, classified as either LDLs, which are low-density lipoproteins, which move cholesterol from the liver to the organs and tissue, and HDLs, which are high-density lipoproteins. These move unused cholesterol back to the liver for recycling. By removing this cholesterol from the blood vessels, HDL helps protect against things like atherosclerosis. They also inhibit oxidation, so there's fewer reactive oxygen species. This means that there's an increase in inflammation and there's a decreased cancer risk as there's less binding of these oxygen species to free radicals. There's also activation of the endothelium and coagulation and platelet aggregation, meaning that HDLs protect against atherosclerosis. But LDLs aren't as nice. They can accumulate on the arterial wall and then are oxidised by free radicals. This causes an accumulation of inflammatory cells, causing a plaque formation. They can be taken out of circulation, but people with the familial hypercholesterolaemia means that there's a mutation in the LDL receptor on chromosome 19. This receptor usually uptakes the LDL from the bloodstream, but if it's mutated, then the LDL can't be taken up and remains in circulation and accumulates on arterial walls. This can be treated through lifestyle changes and drugs. So, if we talk a bit more about familial hypercholesterolemia, which you can short it to FH because that's a mouthful, it's an autosomal dominant gene that can be inherited. It affects around 1 out of 250 people worldwide, but there is a low diagnostic rate, so only about 10% of these are diagnosed. If you have this mutation, then you have an increased risk of having a heart attack by at least 50% by the age of 50, and it can be tested for using a PCR. So you can either be hetero or homozygous for the gene. Heterozygous means that you have one functional gene and one mutated gene, meaning that you've got 50% of a normal receptor. If you're homozygous, then you have two mutated genes, so you totally lack a functional receptor. So there's absolutely no uptake of the LDL, and this often leads to early death in childhood due to coronary artery disease. So, if you test 3 patients for the FH mutation, first off you have to extract the DNA, then you have to amplify the target gene in the DNA by PCR. You then have to do restriction digest using restriction enzymes. This results in different places being cut because there's different digest sites present in the healthy and the mutated gene. Therefore, the mutated and the normal gel patterns when you run them on a gel differ because the restriction sites may not be there, so it could be cut differently. So you can then compare the banding of the different samples against the expected banding of a normal gene and a mutated gene and determine which ones carry the normal FH gene and which ones carry the FH mutation.